Have you ever noticed your dog, or maybe your cat, just suddenly seems glued to the water bowl, drinking way more than usual,
Hmm.
and then, well, consequently, they need to go outside, like all the time?
Yeah, constantly asking at the door.
Exactly. And you kind of wonder, is this just a weird phase, or could it be something more?
That's a really common observation, actually, and it perfectly sets up what we're diving into today. We're going to talk about a condition called hyposthenuria.
Hyposthenuria,
Okay.
which can show up in dogs and cats with exactly those signs you just described, the excessive drinking and urination.
Right. So we've been digging into some really good sources on this, trying to understand it better for our listeners.
Yeah, trying to boil it down.
Our mission today is basically to explain what hyposthenuria actually is, maybe what causes it, and really why paying attention to those water bowl habits is, well, pretty important.
Okay, so let's define it simply first. Hyposthenuria just means the animal is producing urine that's, well, it's very dilute.
Right.
Way more watery than it should be. Okay, dilute. How dilute are we talking?
We're talking specifically about urine with a specific gravity between 1.00 and 1.006.
1.00 to 1.006. And
So
look,
it's normal.
well, that's the key comparison. Normal urine is much more concentrated. For dogs, it should typically be above 1.030.
Oh, okay.
And for cats, they're even better concentrators, so usually it's above 1.035.
That is a huge difference. It's like the kidneys are just not doing their job of packing the waste in properly.
That's a good way to put it. They're losing their concentrating ability.
So the big question then is, what could possibly cause the body to start making urine that's practically like water?
Right. And to get that, it helps to quickly think about how it normally works, how the body makes concentrated urine.
Okay, the normal process.
It's actually a pretty amazing system. It relies heavily on something called antidiuretic hormone, or ADH.
ADH. Okay.
Think of ADH as the manager telling the kidneys, hey, hold on to water. It talks to specific receptors in the kidney's little tubules, these tiny pipe-like structures.
Telling them to reabsorb water. Exactly. Pull water back into the body. But there's another crucial piece. The inside of the kidney, the medulla, needs to be really, really concentrated itself. Super salty, you could say.
Oh, like a salty sponge deep inside.
Sort of. That saltiness, that hypertonic interstitium, is what creates the gradient to actually pull the water out of the tubules when ADH gives the signal.
Okay, so you need the signal, ADH, the workers, the tubules, and this salty environment.
Yeah.
So how does this system break down and lead to that really dilute urine, the hyposthenuria?
Well, it can go wrong in a few main ways. First, you could have problems with ADH itself.
The signal.
Yeah. Maybe the brain isn't making enough or releasing enough. That's a condition called central diabetes insipidus.
Okay.
Or maybe there is enough ADH, but the kidney tubules, those workers, just aren't listening to the signal. They're resistant.
So the message isn't getting through.
Right. And that's called nephrogenic diabetes insipidus. So those are two key things we think about problems with the hormone signal.
Makes sense. Either not enough signal or no response to it. What else can go wrong?
Well, you could have direct damage to the kidney tubules themselves. If they're hurt, they just physically can't do the concentrating job, even if ADH is there.
Okay, physical damage.
And then there's something called medullary washout. Remember that salty environment inside the kidney?
Yeah, the gradient.
Sometimes that can get diluted, washed out. If it's not salty enough, there's less pull to reabsorb water, even with ADH present.
So the sponge isn't salty enough anymore.
Pretty much. And interestingly, sometimes the kidneys and hormones are fine, but the animal is just drinking excessively, compulsively.
Like, they can't stop drinking.
Exactly. It's called primary polydipsia, or sometimes psychogenic polydipsia. They drink so much water, it just overwhelms the kidney's ability to keep up and concentrate the urine. They're basically flushing themselves out.
Wow. So, okay, tying it back. The signs we first mentioned, the increased drinking polydipsia and the increased peeing polyuria that we see with hyposthenuria,
Yeah.
those are basically the body's reaction to this water regulation problem.
Precisely. The body knows it's losing too much water in this dilute urine, so it screams, "I'm thirsty," to try and replace it. That's the polydipsia. And the polyuria is just the direct result of not being able to concentrate the urine.
And you sometimes see incontinence too, right? Just from the sheer volume.
Occasionally, yeah.
Yeah.
Especially in dogs. Just too much urine being produced for the bladder to handle comfortably all the time.
Okay. Now, you mentioned diabetes insipidus, but it sounds like there's a whole list of potential culprits here. You use the term differential diagnosis. What are some of the main underlying causes vets look for?
Oh, absolutely. The list is pretty broad. Infections are a big one.
Infections, like what?
Things like pyometra, that's a serious uterine infection in female animals,
Yeah.
or pyelonephritis, which is an infection up in the kidneys themselves.
And how would you spot those?
Often, blood work gives clues. You might see signs of inflammation, like a high white blood cell count, maybe what's called a left shift, meaning lots of young white cells are being pumped out to fight. And the urinalysis itself might show inflammatory cells or even bacteria.
Got it. Infections. What about hormone problems besides the ADH issues?
Definitely. Other hormonal imbalances are really common causes. Cushing's disease, the technical term is hyperadrenocorticism.
Too much cortisol.
Exactly. That's a frequent cause. But also the opposite, Addison's disease or hypoadrenocorticism, where they don't make enough cortisol and related hormones.
Okay.
And even hyperthyroidism, especially in cats, can sometimes lead to it.
Wow. And do these leave clues in the blood work too?
They often do. With Cushing's, for example, you very commonly see a high level of an enzyme called ALP, alkaline phosphatase, and maybe high cholesterol.
Well,
With Addison's, the classic signs are electrolyte changes, typically high potassium and low sodium. Those can be big red flags.
it's incredible how it's all connected. Are there metabolic issues, like things related to minerals or electrolytes that can cause this?
Yes, absolutely. Two key ones are hypercalcemia, too much calcium in the blood, and hypokalemia, which is low potassium. If we see low potassium on the blood panel, that could definitely be contributing to the poor urine concentration.
And what about major organs? Can, say, liver problems or even the start of kidney failure itself cause hyposthenuria?
Yes, for sure. Early stage kidney disease, before you see really dramatic signs of failure, can impair the concentrating ability.
So it can be an early warning sign.
It can be, yes. And primary liver disease can also interfere with things that affect water balance. Interestingly, sometimes dogs with Cushing's disease also have mildly high bile acids, which usually points towards liver function, so it can get complicated.
It really sounds like detective work for the vet.
It often is.
And I think I read somewhere, can medications cause this too?
That's a super important point. Yes. Several medications are known to interfere with urine concentration and can push the specific gravity down into that hyposthenuric range.
Like what kind of drugs?
Well, corticosteroids are a big one, like prednisone or cortisone that pets might be on for allergies or inflammation.
Okay, steroids.
Also, lithium, certain antibiotics like dimeclocycline, an older anesthetic called methoxyflurane, some diuretics like thiazides. Even just getting intravenous fluids can temporarily dilute the urine significantly.
Wow, so you always have to check the medication list.
Always. It's a crucial part of the history.
Okay, so let's say a pet owner sees the signs, goes to the vet. How does the diagnostic process usually unfold? What's step one?
Step one is almost always the urinalysis. You have to check that urine-specific gravity. Finding it in that 1.00 to 1.006 range is what confirms hyposthenuria.
But that's just confirming the sign, not the cause.
Exactly. It tells us what is happening, but not why. So the next step is usually blood work, a CBC, complete blood count, and a biochemistry panel.
And that's looking for those clues we talked about.
Precisely. Looking for signs of infection, inflammation, those elevated liver enzymes, the electrolyte imbalances like calcium or potassium issues, signs of kidney dysfunction. It helps narrow down that long list of possibilities.
Okay, urine and blood tests. What else might be needed? Are there more specific tests?
Oh, yes. Depending on what the initial tests suggest, we might need more specific lab work. For instance, if we suspect Cushing's or Addison's, we'll run tests like measuring ACTH levels or doing an ACTH stimulation test.
To check the adrenal glands.
Right, or a low-dose dexamethasone suppression test, maybe a urine cortisol to creatinine ratio. Those are often used for Cushing's. If liver disease is suspected, we might do serum bile acid tests to get a better picture of liver function.
And what about differentiating between, say, the ADH problems and that excessive drinking thing?
Yeah. That's where the modified water deprivation test comes in. It's carefully controlled, of course.
Sounds intense.
It is, and needs close monitoring. But it's designed to see if the kidneys can concentrate urine when water is restricted. It helps tell apart central diabetes insipidus, nephrogenic diabetes insipidus, and that primary polydipsia.
Okay, that sounds like a really key test for those specific cases. What about looking inside? Imaging.
Imaging is often very useful. X-rays or radiographs can show us kidney size and shape, maybe look for stones, or sometimes even signs of adrenal tumors or an enlarged uterus suggesting pyometra.
Ultrasounds, too.
Ultrasound is fantastic. It gives a much more detailed view of the kidneys, the adrenal glands, the liver, the uterus. It's often a go-to imaging tool.
Any other imaging?
Sometimes, if we suspect pyelonephritis, a special X-ray with dye called an intravenous pyelogram might be done, though ultrasound is often used now. And in rare cases, if we suspect a brain issue affecting ADH, like a pituitary tumor, then MRI or CT scans might be needed.
So a whole range of tools depending on where the clues lead.
Exactly. It's a step-by-step process.
So once the vet figures out the underlying cause, what's the approach to treatment? Is there one treatment for hypostenuria?
No, not at all. Because
Yeah.
hyposthenuria itself is just a sign. The treatment entirely depends on fixing the underlying problem.
Right.
If it's pyometra, the treatment is usually surgery. If it's Cushing's, there are medications. If it's hypoklemia, you supplement potassium. You treat the cause.
So just restricting water wouldn't be the answer usually.
Generally, absolutely not. Unless you have a very specific diagnosis like primary polygipsia, where careful water management might be part of the plan under veterinary guidance. Otherwise, restricting water in an animal that can't concentrate its urine is dangerous.
What's that?
Dehydration. You could easily cause dehydration because their body simply can't hold on to water effectively.
Ah, okay, that makes total sense. So focus on the cause. And once treatment starts, what kind of monitoring is involved?
Monitoring is key. It is the most direct and significant risk, yes. Because the kidneys aren't conserving water, the animal is constantly losing excess fluid. If they don't drink enough to compensate, maybe they feel unwell from the underlying disease, they can become dehydrated relatively quickly.
Gotcha. One last practical question. Let's say a vet wants a urinalysis, but maybe getting to a vet lab quickly is tricky for someone. Can a human lab run that test?
Yes, that's a good point. For the basic urinalysis, including the specific gravity measurement, a human laboratory can definitely run the sample. The principles are the same.
It's good to know. Okay, so let's try and summarize the big picture here. What's the main thing you want people to take away about hyposthenuria?
I think the key takeaway is that while hyposthenuria is defined by that dilute urine, it's almost never the end of the story. It's usually a flashing light, a signpost pointing towards a bigger underlying health issue in that dog or cat.
Right, so that increased thirst, that increased urination, don't just ignore it.
Absolutely not. See your vet. Because figuring out that root cause, whatever it might be, infection, hormone imbalance, kidney issue, medication side effect, that's the crucial step to getting the right treatment and helping your pet feel better.
It really does show how these, simple seeming behaviors, like drinking water, are tied into such complex body systems.
It's incredibly intricate.
Yeah. It makes you think, doesn't it? When you consider this whole balance act hormones, kidneys, electrolytes, even just thirst. What other subtle little changes in our pets might we be missing? What else could be a quiet signal of something shifting inside that maybe needs a closer look?
That's a great thought to end on. Just encourages that careful observation, doesn't it? Being proactive.
Definitely. Food for thought for all of us pet owners.